as chiropractors, we don't pay a lot of attention to medications generally because, that's not our ball of wax, so to speak. But this will definitely help you if you do this right. Help you meaning it will help to establish the need for care. It'll help magnify the injury, and it'll help magnify the need for future care if you do this right, as opposed to, just taking whatever medications they say and then not even applying them appropriately. So this is what you want to do with the medications and how they will help you. So once again, I want to dig for the medications, and I want to dig for them for these reasons. Number one, if they're on medications like analgesics, a lot of times I'm going to be able to use that as reasoning for re-exacerbations and support for the need for care. Maybe you need to do prolonged care. They're not responding as quickly. And so one of the things that I'm going to point to is that they're taking analgesics, which makes them think that it's chemically induced. So it's basically fake healing, and it's chemically induced reduction of pain that gets them to think that they can, go back and resume normal activities, and when they do, they have re-exacerbations. That is, and this is what I'm sharing with you now is very common arguments. These are not incidental. This will happen like 80% of the time. These are very common scenarios and how I use them regularly. So it'll help with the need for present care, extended care, and future care. So let's cover some of them, make sure we're clear. So once again, I want to be very proactive and go after this because it can significantly help you in these ways. And let me share with you how that works. So the medications that I'm looking for specifically are analgesics, things that help decrease pain, and non-steroidal anti-inflammatories. Those are the two that I am really proactively going after. So aspirin, Motrin, ibuprofen, Aleve, all those medications. And remember when you say medications to patients, they typically think prescription. They don't think anything about over-the-counter. It's kind of amazing how people, I can't tell you how many times I've asked patients, are you on any medications? And they go, no. And then I'll say, are you taking anything over-the-counter like aspirin, Motrin, ibuprofen? Even if it's just infrequently, are you doing anything like that? And they'll go, oh, yeah. And I just asked them if they were on medications. And so you've got to be unbelievably highly aware to not just say medication. You have to flat out say over the counter and give a menu. Remember, it's easier to understand a menu than if it was an open-ended question. So I'm going to ask the common menu of I'm going to ask a menu of the common over-the-counter medications like aspirin, Motrin, ibuprofen. I'm going to menu those. I'm going to say them. So there's a big difference between that and you saying, are you on any medications? Or if your sheet just says medication and you're having them fill out the sheet, and then you never interrogate or say anything about it again. That would be a big mistake. So, even in your medication section, I'm not only doing prescription, but itemizing out over-the-counter as a category, and give a menu of common over-the-counter, like what I just did, as opposed to it just saying medications, and then you never talking to them about it. Okay, so that's how you find this stuff, is by digging better. Now, so how does this relate to everything? Well, in my whether it's my narrative, whether it's in a soap note or a medical report or a narrative, remember if they're analgesics, that would be reasoning for multiple things. And this will be put into a narrative report or a medical report. If they're on any type of analgesics at any frequency at all, because let's face it, if they were 100% normal, they wouldn't take any analgesics. So that helps to suggest, yeah, there is a problem for them to take it. But here's what it does is, these are some of the main points of consideration that I'm going to be stating commonly. This is going to be very common. I'm going to state these things. Is if they're on analgesics, it creates false negatives. It lowers testing. It lowers your findings for your exam procedures and decreases positive findings and creates false negatives. I'm going to say that. It decreases positive findings and it increases false negative findings, meaning that maybe they have a low-grade positive, what would have been a low-grade positive test, like range of motion and overpressure. Maybe it would have been a grade 1 without ibuprofen. But with ibuprofen, now it's 0. That's an example. That's kind of a classic example, by the way. So one is the tests. 2, that also can result in reexacerbations because the patient has a false sense of security due to the lowered pain threshold, and so they will resume normal full activities even though the tissue is not healed 100%, and this often causes reexacerbations. Now, if I were you, I would remember what I just said. This is a main supportive component for extending care. When you need to treat somebody at a higher frequency or longer, this is a common supportive argument that they had reexacerbations, but also I'm going to be including possibly why, and one of those is medications. So it either reduces positive findings or it creates false negatives, which again creates reexacerbations, prolongs healing, and prolongs healing time. I can't tell you how many times I've used that. I mean, it's almost, because people are, they're almost, everybody is taking aspirin or Motrin or ibuprofen to some degree, especially after an injury. And so that was routinely entered in my medical reports or SOAP notes, and it helped supported prolonged care. So remember, if you have prolonged care and you don't have any documentation why it's prolonged, that's when you get IMEs. In other words, there's no reasoning behind what you're doing. And when there's no reasoning behind what you're doing is when you get your bill. That's when you get, IMEs, and that's when they stop paying your bill and all that kind of stuff. So you have to have reasoning behind everything you're doing. And so this was a very common scenario with medications. And then the third one is, the third category are the NSAIDs. Remember, the NSAIDs, the non-steroidal anti-inflammatories, inhibit collagen synthesis. And for you guys that maybe are too young to remember, there's a football player called Dick Butkus. He's a really good linebacker on the Chicago Bears in the early 70s, 60s and early 70s. And he won the first $1 million soft tissue injury lawsuit. Dick Butkus did. And the reason he won it is because they kept injecting his knees with steroids. And the steroids obviously obliterates collagen. So they kept injecting his knee. You know, you got to remember, this is the early 70s before, you know, they're aware of all this stuff. So they're injecting his knees with steroids to make him feel better so he can play, you know, strong anti-inflammatory so he can play Sunday. And by the way, this is exactly why they will not give a steroid injection more than 3 times in any one particular joint. This is why. Because it destroys collagen. And so he sued. So when he, you know, down the road, when he found out about it, he wasn't told that it destroys collagen, and it basically wore out his cartilage in his knees and basically made him a cripple. I think he's got fake knee, both joints are fake knees now. But he's one of the first people that sued and won over $1 million lawsuit for soft tissue injury. So kind of keep that in mind, the importance of these. So non-steroidal anti-inflammatories will inhibit collagen synthesis. Well, what does that mean relative to the patient, relative to you? Well, what it means is it makes that anatomy weaker. If I have 10 strands of collagen and I take away 5, I'm going to have weaker tissue. That's just all there is to it. So what does that mean to the patient? It means I'm going to have higher likelihood of re-exacerbations. Well, definitely, number one is I'm helping to, when that happens, you're helping to propagate a permanent injury through weakness. And remember, the collagen synthesis is limited. The collagen synthesis only happens during the repair phase. It does not happen in the inflammation phase, and it does not happen in the remodel phase. That's why they call it repair. And so there is a window of opportunity for this to happen. And when the non-steroidal anti-inflammatories are taken during that repair phase of healing, that's why it's so important that patients do not take any non-steroidal anti-inflammatories at all during the repair phase. That's why it's so important. You got one chance at this. And so if when they take those, it decreases the strength of the tissue. And what does that mean to the patient? Number one, it's creating a permanent injury. Number two, it's perpetually weakening the area, which allows, when the patient does their normal activities of day-to-day, will increase the likelihood of re-injury. That's what that'll do. So that's what I'm going to be paying attention to. And so that's what I'm specifically looking at for medications. And those are pretty much the 3 things I'll routinely say regular. I mean, you should just like write it down, those 3 things, and then it should be like copy and paste. It should just be, whether it's a SOAP note, whether it's a medical report, or whether it's a narrative report. Dig hard for analgesics, non-steroidals, dig hard for them, and if they have any of them, and then any of them at any frequency, then include those factors. And that helps to, helps support the need for care. If it's prolonged, it helps to tell why they're not responding as quickly as what they should, and that's very common. And it helps to support that there's a permanent injury, and there's going to be an increase in the likelihood of re-exacerbation because that tissue is just not as strong. It can't hold up over the same activity level.